My name is Devi, and I'm here to talk about my dad, who was hospitalized on October 26th. He developed a lung infection. He was not able to breathe, so we took him to the multi-speciality hospital nearby, and he was in an emergency, and then they asked us to shift him to the ICU because his heart condition also was poor, and he had lung edema. So then once he was shifted to ICU, they had done couple of tests to just check on him. And after 24 hours, they told us that his condition is very bad and he might need an intervention, otherwise he will not be able to make it. But owing to his age, he's 86 years old, we thought that might not be a good suggestion, or so we decided we'll not have an intervention, but then the doctor said then it will be very difficult for him to make it. So anyhow they tried for a few more days. They kept him in the ICU, but his kidney also started deteriorating. His creatinine level came up. So after 4 or 5 days in ICU, then as not much could be done there, they shifted him to ward to see how he is progressing. But he still was on oxygen support, almost some 4 or 5 liters of oxygen per day, and but there was not much improvement in him. So after 2-3 days, the doctor said it is better we take him home, because he can be on the same medicine, but he will not be able to make it because there is not much can be done to him. And because his condition was not that good, we were not knowing where to take him, mainly how to take him home, how can we take care of him. So we heard about Sukino, where they take care of these kind of patients, and then they give us a lot of hope. So I met Rajni and Dr. Aftab. So they explained me how they are going to take care of my father. So they said they will give the same support, oxygen support and the medicines, and the doctors are there 24/7 to take care of him, and a good nursing station, so who will be there 24/7 to take care of him, and attenders to help him in everything. So we thought, okay, we will shift him to Sukino with no hope at all. Actually speaking, we never had any hope that he's going to make it home. After 2 days, we literally realized that he was surviving without oxygen support, and that's when our hope started. Again we had hope in him, and again he had little more complications and everything, but Dr. Aftab helped, was there immediately to give him medicines, and he was giving us all the positive vibes that he is going to make it. And today on November 30th, he is fine, completely fine, and he is without oxygen support, no catheter. He's eating, he's drinking, he's walking, and we are taking him home. So I would highly recommend Sukino for all those patients who are in this kind of stage, who want hope. They can come here and they can really have a hope in their life. Thank you so much.